I'm Mike Silverman, a member of the board of STAR, and I'm honored to be the chairman of this capital campaign, this wonderful, effective, and successful capital campaign. It's been a sort of a long and tough road to hoe, but we've done a great job. Here we are, ready to break ground, if only symbolically. And you know, being a sailor, I think of the weather out here. Nancy comes from a sailing family as well. So today we'll call her Skipper Nancy and the good boat Star. And she brought it into a safe port where we can be comfortable and dry. I'd like to start today by introducing Representative Alan Sylvia, who is the vice chair of the Joint Committee on Public Safety, and of course one of our local representatives.
Thank you, Mike. Thank you. So Representative Speaker Pro Tem Haddad couldn't be here, and so I'm trying to fill in, do the best that I possibly can in her absence. I want to thank, first of all of you for being here, and the importance of, just look at the numbers of people who are here. That sends an incredible message to this long-awaited event of this groundbreaking today, so important. Nancy Paul has done an incredible job fighting every windmill that you can imagine to get this underway. We only hope that she sticks around for a while. I keep hearing whispers that she's getting ready to retire. Don't retire, Nancy, please. You've done so much incredible work to save lives in our community. Integrated care, that's what this is all about. Integrated care, and one doesn't exist without the other. And this is such an incredible feat to ensure that lives are saved and are continued to be saved in our community. So again, I want to thank everyone who is here, because you're all part of this. You're all part of this process, and you've all had a hand in making it work. So thank you all, and best wishes to this great day and this event. Thank you, Mike.
Thank you, Alan. I think most of you know Nancy Paul. She's been a member of this community for 40 years now, the STAR community, which is incredible. She's seen it grow from a very small healthcare center and to what we have today. And without further ado, I'd like to have Nancy come up.
So this is such a wonderful day. It's a wonderful day because we can finally move ahead to provide treatment and recovery to our clients and their families. It is wonderful because we come and celebrate this great accomplishment that we have made together. And I want to say that, together, as a community of philanthropists who see that the dignity and humanity exists within the hearts of those suffering with substance use disorders. People with substance use disorders have a basic human right to health care. All of you in this room and many people who could not be here today deserve so much more than a simple thank you from me. But you will soon see the fruits of your labors when we open up our center a short year from now. I undertook this task with great trepidation, not because I didn't think the facility was necessary, because it is necessary. And in the last year alone, we have lost 67 people who have overdosed in this city alone. Nor was it the fact that raising this kind of money had not been done in the history of STAR, in the 47-year history of STAR. But for my own self, I'm really a pretty shy person. And and I didn't know if I could share my vision outside of the people who normally support it and are involved in the work that we do. And I thought, quite frankly, I would hate doing it. But you know what? It has become one of my favorite things that I have done in my career. Under Gary Schuyler's tutelage, I've met amazing people that I am so grateful to have met. Lovely people who are willing to brush past the stigma and see what damage this disease causes and wants to do something about it. People who I didn't know that I now consider friends. And there are old friends that have bent over backwards to see that this project was developed. The staff of STAR, and many are here today, who have cheered us along the way, who have, even though our staff are paid below what other healthcare professions make, they committed their own dollars to be sure that this project got off the ground, and I am eternally grateful. Anthony Audiello and his staff and Architecture Plus, who have hung in with us through all the contortions we've had to make to get this building off the ground. And I sort of say I'm Anthony's work wife because he says one thing and I say another, and then we sort of battle it out. And I am so proud of the building which is displayed beside me. And to our donors, and the donors are all listed over here, and I don't want to say individual names because I don't want to forget anybody, but this is a list of partial donors. I think we've had over 100 donors to this cause, maybe closer to 200. And I'm just so appreciative that you're working with us to make this happen. I want to thank you, one and all. Thank you from the bottom of my heart. And I'm so grateful that you're here, that you support our vision, and this will make Fall River a better place to live in. So thank you very much. So now I am proud to introduce my good friend, Dr. Elizabeth Saenz. Elizabeth and I became involved together with TreatNet 1. TreatNet is a project of the United Nations, and it was born out of a very few powerful women, I want to say, and the goal of TreatNet was to help under-resourced countries develop evidence-based drug treatment. Dr. Saenz and I have been all over the globe working with countries of Afghanistan. We've been to Sri Lanka, and we were actually just in that hotel that was bombed right after we left it. We have been to Egypt and China and Uzbekistan and Kyrgyzstan and Kazakhstan. And it's Elizabeth's vision that has kept TreatNet going through the years. She is a pediatrician by trade and came to the UN about 15 years ago. And and I am so honored that you would come today and help us with this ceremony for the groundbreaking of our evidence-based integrated primary and behavioral health care facility.
Thank you very much, Nancy, for that beautiful introduction. I have to say that for me it's a great honor and really a privilege to be able to be here today in my condition as a UN officer. She made sure that I got permission from my boss to be here today and speak on behalf of the UN, to accompany Nancy and the STAR staff in this groundbreaking ceremony for the future integrated services at STAR. But beyond celebrating, I would like to acknowledge the achievements of a tenacious woman and her team that are driven by the conviction that people affected by drug use disorders deserve to be treated with dignity and receive the quality of care that is provided for any other chronic health disorder. Drug use disorders are a public health and a security problem, not only in developed, but also in the most developing countries. According to the World Drug Report, which is a document we produce every year in the United Nations, 300 million people around the world have used a drug when asked at least once in the past year. and 35 million people are affected by a drug use disorder. Now the problem is that unfortunately only 1 in 7 in average receive the treatment and care that they deserve. And this is very sad when we look at the numbers in various regions, because in Africa it's only 1 in 18. In Latin America, 1 in 13. And maybe you won't believe that, but in this country it's only 1 in 11. Women are hit the hardest. While 1 in 3 people with a drug use disorder is a woman, only 1 in 5 of those that are in treatment is a woman. So something needs to be done. Limited access to treatment for drug use disorders is the result of the stigma and discrimination which is associated with this problem. It results in limited availability of services, inadequately and insufficient number of qualified professionals, and the saddest, because we've seen this all over the world, rampant violations of human rights through oftentimes even cruel practices that are delivered in the name of treatment. A moral failure, a self-acquired condition, are some of the hiding, the rationale, hiding the non-recognition, and I dare to say today, ignorance about the real nature and root causes of drug use disorders, which are mostly a long history of suffering, violence, abuse, trauma, neglect, mental health, poverty, and socioeconomic inequalities. No one ever makes a choice to become an addicted person or dependent on a substance. Louise Hay said, "The main cause of hunger in the world is not the lack of food, but the lack of love." I dare to say that it is the same reason why people affected by drug use disorders face so many challenges to access the help and care that they so desperately need. I would like now to make reference to a phenomenon that has really kind of confused us, that we don't know what to do in the UN with the opioid crisis that you're experiencing here in the US. Opioids, including heroin, are the most harmful substances. They are associated with fatal overdoses, with hepatitis C, with HIV, with all sorts of complications. In the US, we have seen this phenomenon of pharmaceutical opioids, fentanyl, heroin, causing an epidemic of a proportion we never saw anywhere else in the world. And the number of overdose deaths in the US account for 1/4 of all drug-related deaths around the world. Between 2010 and 2018, opioid-related deaths increased more than 5 times here in the US. And indeed, more people die here because of opioid overdose than road traffic accidents and violence. These premature deaths are surely avoidable. Treatment of drug use disorders is effective, but it requires a combination and comprehensive treatment and care that includes pharmacological treatment options, psychosocial treatment options, and the integration of services into the health system. And this is precisely what STAR is doing here. Yeah? In my work advising countries all over the world to organize, helping them to organize treatment services for people with drug use disorders, STAR represents a gold standard and an example of good practices. James Allen once wrote, "Circumstances do not create a man, they reveal him." I believe that Nancy's and STAR response to the opioid overdose crisis in this part of your country has revealed the strong and determined woman that I had the privilege and honor to meet back in 2005 when STAR was selected as one of the treatment centers of excellence to be a member of the international network of treatment centers around the world. Since then, Nancy has become one of our lead experts supporting the United Nations efforts to improve quality of treatment services worldwide through the development. I think she's been involved in everything, developing technical tools, training materials. She's a trainer herself. She's shared all her experience as a manager. Study tour opportunities. We have sent people from Kazakhstan, from Ukraine, from Russia has been here STAR to learn from her and from her team, who are generous enough to share their experience and knowledge to the noble cause of helping people affected by drug use disorder. As a UN staff member, I need to make reference to the Sustainable Development Goals. There is one of the 2030 Development Agenda goals that refers specifically to universal access to healthcare. From the perspective of drug treatment, drug use disorders, it is impossible to achieve universal healthcare access if we do not take care of the people affected by drug use disorders. The STAR model of integrated care is the most effective way of achieving this, so I congratulate you again and express my gratitude on behalf of the poorest of the poor, who are the people affected by drug use disorders. Nancy and the STAR staff, thank you for giving me this opportunity. It's my real honor and pleasure to be here. Thank you.
I have the pleasure of introducing Congressman Joe Kennedy, who's been a great friend to STAR. He's supported our efforts from the very beginning with his advice. Staff members have been made available to us. He's visited with us several times. And I couldn't be happier to see you here today. And I'd really appreciate it if you make a few remarks. Thank you.
All right.
Good afternoon, everybody. Grateful to be here with everybody today. Thank you for the opportunity. Thank you for letting me join you. I'm going to say something that I think everyone here is going to agree with. Nancy is amazing. So I don't remember when the first conversation happened, but I assumed that it was one of many that we have had where Nancy had come in, either I was down here or she had come all the way up to our office, headquarters up in Newton, and started talking about her vision to ensure that every single person in our country, every single person in our Commonwealth, every single person in our community got access to the care that they need when they needed it. The basic fundamental promise that I believe our country should make to its people. And that Nancy was trying to make that true in Fall River. And I said, great, so how can I help? She's like, well, I got this idea, right? Nancy, you buried the lead there a little bit, right? But not only did she have an idea, she had a vision. She knew what she wanted to do, she knew how she was going to do it, and she stops at nothing, nothing to get it done. Congratulations for your tenacity and your commitment to this community, and for making sure that we live up to that promise and that value that so many of us hold dear. Nancy, this day in large part is a celebration of what you have brought to it, so congratulations.
Thank you.
There are a whole lot of partners in this room that made that happen. You can't do something like this without picking an extraordinary campaign chair. Michael, well done. Congratulations. Joan, always a pleasure. And for all that you have done to make this happen as well. Grateful to our colleagues in federal and state, local government that are here. I see many of you. I'm sure if I start going through the list, I'm going to miss somebody. I'm not going to be in trouble. So thank you, thank you, thank you, and everybody else, thank you. I don't see Pat Haddad in the room.
She's not feeling well today.
Okay, good. Pat, thank you too. I started the comments by saying that this was, in part, an extraordinary affirmation of the vision and dedication of Nancy. It is also an affirmation of the vision and commitment and dedication of public officials in the room and the commitment of everybody else here. It's about the commitment that all of us try to share to a community coming together to fight the throes of addiction, mental illness, substance use disorder. It's about the patients that are asking for nothing more than help, are trying to get better, and seeking a pathway to do so. And about the failures of a system that for far too long has put up barrier after barrier for them to get better. And about a community that has said, we will tear every single one of them down because we believe in our people. and we believe in our neighbors.
Yes, sir.
We believe in our family members, and our parents, and our brothers and sisters, and our kids. Because I don't think that there's a family represented in this room today that doesn't have a family member or a close friend that has been touched by mental illness or substance use disorder or probably an opioid addiction. This isn't just about a building. This isn't just about a value. This is personal. And I'm so grateful to be here and sharing this moment with all of you. Thank you for including me. Congratulations.
Thank you for your remarks. It's funny, as chairman of this capital campaign, I see myself as just a cog in a wheel. There were so many that gave me such assistance, Gary Schuyler, all the members of our steering committee, the donors, of course, who stepped forward and spoke to their friends and neighbors and just helped to make this possible. Oh, and Steve Howitt, I forgot to acknowledge you here. I'm glad to see you. It was wonderful. But what we are doing today, what we call our groundbreaking, has become more symbolic than real, simply because of the weather. But what it's really about is a celebration. An opportunity for all of us to get together and not pat each other on the back, but to thank each other for getting to this point. It's an incredibly humbling and exciting experience, and I'm sure that you all share it. Now we'll get down to the brick and mortar part of the project. We still have a few dollars to gather to wrap it up. We're close, but we haven't quite reached the finish line. I'm very confident, I think as soon as people see that we've broken ground, that the building is going up, there'll be continued support and enthusiasm for the project. I'd now like to introduce Joan Menard, the chairman of the board of SStar, for some additional comments. Thank you.
Thank you all for being here. The one thing I think I'd like to do is ask the board members who have worked so hard over the last 2 or 3 years to stand up and be recognized. So the board members, please.
And steering committee.
And the steering committee, yes. Would you stand up for a minute, please? So we can say thank you. Thank you. As most of you in this room know, it hasn't been easy, but good things happen, and most of the time they're not easy. So I want to thank all of you to being here today. We have a lovely luncheon, and I think the congressman has agreed to let people take a picture with it. I'm not sure, that was in my notes, I'm not sure he agreed, but and so thank you to the board members, thank you to the people who have made this happen, thank you to all of the members of the public here, for the banks, the banking community, the hard work of the staff. It was not hard for us that are on the board to go out and ask for your help because of the wonderful staff and the results that we see day after day after day. And every single person that we brought in here and did a tour and showed them exactly what was happening here were so impressed and said, how can I help? And I have to say, thank you, Doctor. Thank you, all of you who are here, and enjoy your lunch.